Hello! In this video, I'm going to review the book Deep Medicine by Eric Topol. Eric Topol, a cardiologist, a leading figure in the digital medicine, explores the use of AI ML to transform the healthcare industry. The book begins with the current state of healthcare, challenges, the errors, and other stuff that plague the industry. He also talks about the challenges faced by the doctors and what can lead to some of the mishaps that typically happen in the case of healthcare industry. One of the key strengths of book is that its mass appeal, that he explains all the hi-fi concepts in simple terms so that everybody can connect. He talks about history of AI right from 1936 paper by Alan Turing till 2017, 2016, 2017 challenge of human versus AlphaGo. When it comes to application, Eric brilliantly divides the whole spectrum into two different categories. The first one, doctors with pattern, where doctors deal with the challenge which involves studying the patient's records or patients, but which can be properly patternized. For example, radiologists who study the X-rays, tend to follow the same pattern again and again, where the X-ray format remains the same. So these kind of tasks can be performed by AI very well and much more accurately, thereby helping the radiologist reduce the time and spend more time with the patients. It's not a competition to human, but it can augment the work that is being done by the radiologist. This is one example, and there are many examples where the doctors or the doctors with the patterns can be easily transformed or helped by AI related programs. The second application is the clinicians without the patterns. So for example, doctor has to record each patient's history and make an entry into the computer. So these kind of tasks are very boring, and doctors might make mistakes also in doing that. And these kind of jobs also can be replaced by AI with the help of technologies like natural language processing or the voice to text and things like that, and thereby reducing doctors time on these these tedious tasks and helping them spend more time with the patients. So almost all the problems can be divided into these two categories, and can be fit into and AI can be fit into one of these two categories. So overall, if I have to take three key takeaways from the book, that is, one, AI's potential to transform the healthcare industry. I think the book brilliantly covers different examples of how it is currently being used and how it can be used in the future. Second, the ethical aspects. So these AI systems require a lot of data, and how it has to be handled and how it can be taken care is something that book covers. The third is the human AI collaboration. The most important aspect of treating a patient in healthcare industry is that the connection the doctor establishes with the patient. So the AI may not be able to do that reliably. So I think Eric argues that AI can be used to reduce doctors' time on the tedious tasks, and that the time the doctor can spend with the patients discussing their problems in a more humanly fashion. So with that, I would like to conclude this review by saying that this is an important, interesting book if you want to learn more about AI's application in the healthcare industry. Thank you.